Welcome to the Practice Masterclass presented by Magentis. In this episode, we're moving into the world of human resources with the support of HR and Health. Joining us today is George Sotiris, Director of HR, who will be breaking down HR compliance in private practice. Topics will include fair work, compliance, people management, and workplace health and safety. George has extensive experience working in the healthcare industry and a deep passion for fostering positive workplace culture. He often presents at industry events and conferences on workplace culture and management. I'll now hand over to George.
In today's episode, we're going to be talking about HR compliance in private practice. So today's session, we'll be going through experiences and points that we've seen and established across hundreds of practices on a national level. When establishing compliance with Fair Work, there are a few considerations you have to break down. It's understanding our paying conditions with staff and being competitive in the environment that you work within. And secondly, it's maintaining a positive culture to attract and retain good staff. So firstly, paying conditions. Understanding your obligations as leaders and owners is very important with regards to maintaining compliance with modern awards, so minimum terms and conditions are adhered to at all times, and you mitigate the risk of underpayment of wages claims. On the other side, maintaining a happy and healthy culture is one of the most important factors. You want to love going to work. You want to enjoy your workplace. You want to ensure that there's accountability from a management perspective and a people perspective. So we'll go through key tips and elements of how to maintain a positive culture, how you hold yourself and your staff accountable from both a behavioural and a performance perspective. Fair Work compliance can be a very broad understanding for owners and managers. What we'll be focusing on today, though, looks at your minimum terms and conditions that you have to pay your staff. Firstly, understanding which modern awards apply to your clinic is very important. It's generally covered by two key awards, first one being the Health Professionals and Support Services Award and the Nurses Award if you employ any nurses in your practice. These two awards will then underpin what the minimum rates of pay should be, what overtime, penalty rates, leave loading, annual leave provisions apply, and set that minimum understanding of rates. On the other hand, when you're maintaining compliance with the Fair Work obligations, you have to ensure that you are regularly reviewing, or someone within your practice is accountable for regularly reviewing the minimum terms and conditions under these industrial instruments. So understanding coverage, compliance, and minimum terms should be your three considerations when trying to maintain compliance under the Fair Work modern awards. Secondly, Fair Work is not only a regulator for minimum terms and conditions, but the regulator with regards to how we manage our people. So when it comes to performance management, terminating staff, but more importantly, exposure to risks of unfair dismissal claims, general protection claims, stop bullying orders, and other related claims that you might be faced with. So understanding the procedural process when managing people in clinic is very important. So Fair Work wants to see that you're following a fair and reasonable process at all times. So that's making sure that employees are offered the opportunity to respond, that you create awareness, and that you act accordingly based off the issues that have occurred. So we'll be providing some key tips around performance management and what Fair Work deems as best practice. We've touched on the modern awards, and now we want to look at the minimum terms and conditions. So I reiterated the key points around minimum rates of pay. Where do you even start? What do you look at when it comes to what rates should apply for your staff? And how do you then apply penalties, loadings, and allowances? So if you're new or you're exposed to the modern awards, the first key consideration you should do with both the Health Professionals and Support Services Award and Nurses Award is understand what type of employment you're engaging staff. So if that's full-time, part-time, or casual. It is crucial that you pick up these instruments and read the different definitions because they are different across all awards. So understand your obligations around getting casual, part-time or full-time status, correct. Your second tip is then to understand their classification levels. So the modern awards have various levels. So under the HPSS award, Health Professional Support Services Award, you have from level 1 to 9. So establish what level your staff should be, which then allows you to establish the minimum rate of pay that applies to that level. Your rates then allow you to calculate your overtime, penalties, loadings, and allowances. So if you can perfect just those fundamentals and basics of understanding minimum terms and conditions under the modern awards, you're on the right path to compliance. However, it doesn't stop there. You then need to make sure that you understand your obligations to maintain compliance. So whoever is managing your bookkeeping or payroll has to understand what's in your awards, what you do within practice, and what your contracts say. So those three key elements assist maintain compliance. So your contracts of employment should reflect what you do in practice and also link back to the modern award terms to show your compliance. Key considerations around compliance. Once you've established your base level of compliance and the minimum terms and conditions, you can then use this as a baseline to leverage how you position your package and perks within practice. So if you're an established practice and you have staff you employ, great, you'll be able to understand that you pay above award and that your contracts either reflect salaried arrangements or award compliant arrangements. Whereas if you're a new practice and you're setting up, you want to establish that base, you want to do research on what industry rates apply, but you can reflect on packages and perks that attract and retain good staff. So what you'll find in clinic, a lot of staff want flexibility. As a health service though, we can't necessarily allow all of our staff to work from home or have half days off when we are patient facing and we have limited availability to offer flexibility. But knowing your awards and conditions allow you to offer benefits that otherwise practices don't think about. So for example, the awards allow you to average hours over a fortnight or for all 4-week period. This can include saying, okay, rather than working a 10-day fortnight, you can work a 9-day fortnight. So that's effectively 26 days off across the course of a year. So that's a pretty cool incentive and retention tool to offer to staff. You can use that to attract staff in your advertisements, up to 26 days off per annum. So again, these benefits, perks allow you to offer then incentivize arrangements to attract and retain those right people. On the other side of it, it's important that when you're thinking about conditions and terms to think about the sense of entitlement. We have the privilege of working with hundreds of practices nationally, and the benefits with regards to understanding what a sense of entitlement comes from staff is important. So staff want to be recognised. If staff are staying back, working late hours, they want to be paid overtime. Whereas what we're finding in a lot of specialist practices and general practices, when you're paying staff above the modern award rates and you're including all your overtimes, penalty rates and loadings in these loaded rates, it's often forgotten. Whereas if someone receives a penalty rate or a loading or an overtime penalty, they are then obviously compensated for the time they're working these additional hours. So again, understand your base rates, understand your packages, understand how your practice is working to offer a package that is suitable for your working environment. And this will change from clinic to clinic. So avoiding underpayment of wages is a large risk practices place. So you need to have someone who is accountable in your practice or external to your practice that can allow you to maintain compliance across the board. So if you have a bookkeeper or external provider supporting with payroll, or if you've got your practice manager who is accountable for paying compliance, ensure that there are provisions in place to review these minimum terms and conditions annually to ensure that staff do not fall under those rates. Staff have a statutory limitation of claim for up to 6 years to claim back payment of wages. So as an employer, you are ultimately responsible and liable for maintaining minimum terms and conditions. So ensure that you have measures in place to regularly review them on at least an annual basis. In this first half, we've gone through the pay and conditions that apply to your staff. You want to ensure that you start on the right foot and that all your minimum terms and conditions and your remuneration packages reflect what the role should be. However, you're going to be engaging staff in practice. So that comes back to managing people from a cultural perspective, which will be reviewing both behavioural and performance elements of employment. Understanding how you manage people in practice is then governed by Fair Work. So that comes back to following a procedurally fair process when it comes to addressing any key issues that arise. HR elements will generally be some of the most time-consuming areas of management. So as either a practice owner or leader, you will spend the majority of your time putting spot fires out, dealing with issues, and ensuring that there's clear lines of communication and accountability. So as leaders and owners, you want to build and establish accountability frameworks. This will consist of understanding your contracts, having policies, looking at operational procedures that you can hold both yourself and staff accountable for. So managing people in your practice will be one of the most time-consuming parts of your role. So ensuring that we set clear expectations, both with how we manage our people and our procedural processes, is very important. So this will consist of several key HR foundations, including our operational procedures, our employment policies, contracts, meetings, and other elements you might bring into your practice. So ensuring that you have a clear, systemized approach to managing people is important. You'll want to break it down into two key management approaches. The first one being, if you either witness or have behavioural or underperformance issues, you need to be proactive. You need to address it on the day. You need to understand why the issue is occurring, and you need to ensure that you clearly document this back to staff. So if you have a staff member who's coming to work late, is being dismissive, not following orders, or being rude to other staff, it's important that you take the time and energy to sit down with the individual to understand why this is occurring. I've noticed you've come to work late, you've been rude, snappy, and or inappropriate to staff, or your tone's been outside of what we expect as an organisation. Is everything okay? What's going on? Is there a reason why this is occurring? So you want to find that connection with your staff to understand what's occurred, to then re-outline the expectation, provide other lines of support, but more importantly, documenting this back to the individual to hold them accountable if further instances occur. So communication is key. Sending nice, either clear emails or internal communications through your software is also a key element that you should consider. So ensure that those expectations are set and you manage behavioural and underperformance issues when they occur. This will then allow you to then have clear expectations when it comes to your performance reviews, because then you would have addressed all the day-to-day issues, and your performance reviews can all be about development and growth. So again, that continual process will never stop. You want to ensure that your employment foundations support you, and more importantly, that you provide the opportunity for development and growth. So as we step through, I want to provide you some of the key HR tips that you have to be mindful of. Whilst we can talk about compliance and people management over and over, there are 4 key areas as either owners and leaders that you'll have to maintain from a HR perspective. Firstly, understand your compliance. If you're out of your comfort zone, or if you're not sure with how to maintain compliance, build the confidence by understanding the law, getting professional support, and ensure that your staff are not either underpaid or paid in line with the modern award terms. Contracts are so important. They are your backbone of your employment relationship with your staff. They should build compliance from the awards as well. So they will be the backbone of how staff are paid, what hours they work, terms and conditions, things like misconduct, non-solicitation when people leave. So having a good employment contract that accurately reflects how we work in the health industry is important, especially around confidentiality, privacy, and medical records. Employment policies are crucial. Legislation often changes. Over the last couple of years, we've seen several changes to work health and safety laws, bullying laws, sexual harassment laws. all of your policies naturally would have evolved with the legislation that's changed. So you are proactively having to review your employment policies, and you have to ensure that staff have been trained and understand what these professional boundaries are. So that means making sure that they're accessible to staff, that you've done some form of training, and that people are held accountable to the policies. Again, there's no point having amazing policies if you're not proactively bringing life to them, or if staff don't have access, because that's what Fair Work will be asking you is, did staff have access? Can you show proof of training? So ensure that your employment policies are accurate and reflect what your expectations are from a boundary perspective. And work health and safety. Work health and safety has changed dramatically. We have a positive duty to ensure that we provide a safe working environment for our staff. So that's free from harassment, that we're avoiding and mitigating risks. So you need to consider your workplace health and safety framework in practice. 3 key tips from me is understand your hazards, ensure your policies and procedures are in order, and ensure staff know how to fill out and understand incident reporting obligations as well. So these key considerations break down your key employment foundations in practice. Spend the time and energy, as they will work for you when issues arise in clinic, and you can hold yourself and your staff more accountable. Thanks for listening, and that concludes today's episode. And if you're stuck on any of your foundations or element around HR, please do reach out to myself and the team at HR in Health, as we'd love to support you build a better workplace.